Welcome to the On-Call Toolkit of Health Literacy Resources. In this video we will talk about depression and anxiety. You will learn here what depression and anxiety are, what can be their causes and what you can do to successfully deal with them. Have you ever noticed any prolonged worrying changes in your behaviour? Or maybe someone in your family or one of your friends seems sad and has lacked energy for a long time and are unable to find joy in the activities that used to be fun? Sounds like depression, doesn't it? Well, not so fast. Depression and anxiety are described as two of the most common mental health disorders. These are serious illnesses that may affect how you feel, think, and act. Although depression and anxiety often go together, it is important to remember that they are in fact two separate conditions and require different treatment. So what is the exact difference between depression and anxiety? Unfortunately, the answer to that is not so simple, as these two illnesses share some symptoms that can contribute to the development of each other. The symptoms can, however, give you some clues. Anxiety is described as a tendency to have worrying thoughts about what could happen in the future. You can try understanding it better as having a constant overwhelming feeling that something bad will happen and you need to avoid it or stop it, but don't know how. Depression, on the other hand, is a feeling of sadness about the future, as if you stop believing that positive things can happen. People who suffer from depression seem to not expect anything else but negativity in the future, and struggle to see any reason to even try to prevent it. Of course, feeling sad or scared, even for extended periods of time, doesn't always mean that you suffer from depression or anxiety. Grieving or even feeling depressed as a result of various life experiences is natural. Depression or anxiety should only become a concern after your mood and interest are significantly impacted longer than a few weeks. I am sure you instinctively know what are the causes of depression or anxiety. Loss of job, end of important relationship, death of a loved one, sudden accident. These and other factors would certainly trigger a red warning light in your mind. But depression and anxiety can also depend on your personality traits, such as low self-esteem or pessimism, environmental factors like violence, abuse or poverty, or even your biochemistry and genetics. So what can you do to help yourself or your close ones to deal with depression or anxiety? The first step should always be to search for professional help. As mental health disorders can come in many different shapes and sizes, the correct diagnosis is key to receive proper treatment. While suffering from depression, a key feature can be inactivity. That's why it is important to identify and improve aspects of your behaviour that decrease your activity. Address social skills, goal planning or problem solving. When dealing with anxiety, it is especially important to learn stress management strategies. Healthy eating, getting a good sleep, and physical activity are key to maintaining positive attitudes. So do you know the difference between depression and anxiety? And did you know how to deal with them? Depression and anxiety are serious and very common conditions that often require help of professionals. The good news is, however, that they are both normally fully treatable. Thank you for watching. If you want to learn more on this and other interesting topics, visit our website www.oncall.eu where you can find more resources.